Well, I have some pretty serious pain that isn't just isolated to my jaw. I've got some pretty serious neck pain and shoulder pain and back pain. About to turn 17 in 2 days. So I find my thoughts and my processes to be a little bit foggy, and sometimes so much so that it's hard to function in everyday society, whether that's school or things like that. Since 2013, yeah, so 9 years now. And then brain fog, I live anywhere from probably 6 out of 10 to 8 out of 10 at worst. A couple times a month. Fatigue, right. So I live with quite a bit of fatigue. I have a CPAP machine, and that sort of took me from non-functioning to sort of functioning, so.
You had a sleep study?
Yeah, I got a sleep study done with Children's Mercy, and pretty much they told me that I needed to get a CPAP machine. So I got a CPAP machine every night. Pretty much a 0 or 1 out of 10. It was pretty bad. I sort of just rolled out of bed in the morning after an hour of just wallowing around. So I lived probably about a 4 out of 10 and pretty much hit my peak of 7 out of 10 at about 10 a.m. Right. I've had some pretty serious shoulder pain right under my shoulder blades, probably since 2013, around the same time. So 9 years. Pretty even. 4 or 5 out of 10 normally, all the way up to probably a 7 or 8. And that probably usually just happens whenever I use my arms quite a bit. Like if I'm going around and lifting things, or if I'm doing something repetitive like using a shovel or something like that. But typically it gets up to those worst days if we have really high barometric pressure, that can make a difference. So yeah, lower back pain.
Lower back pain.
Just saying around 2013 that I started to notice it. It's gradually gotten worse as I have been. I grew pretty quickly. I grew from like 5'4" to 6'1" in half a year. So it got gradually worse then. I do not have a current diagnosis for my back pain. Yeah, I had amplified pain syndrome, but that's not necessarily isolated to certain areas. It was not diagnosed because of back pain. It was diagnosed because of some pretty serious pain in my feet. So probably like a 4 or 5 out of 10, and at worst, probably almost a 9. But that usually happens because of me overworking myself and not using my knees as much as I probably should. No, I should not. And even sometimes when I get up, I grunt. So sort of feel like an old man sometimes. I've had in the past some pretty serious anxiety, but with some good help from doctors and stuff, I've gotten that down pretty low. But still, I live with probably a 3 out of 10 daily. And if something extreme happens, maybe up to a 6 or a 7. It used to be that it controlled my life, to be honest. And the original help that I got from people was pretty subpar. It wasn't until I moved to West Plains about 10 months ago that I found a really good therapist and psychiatrist. My therapist, Dr. Correjo, has really worked me off of the medication that I was on, because my original psychiatrist over-medicated me quite a bit. Yes, just one, but I'm working my way off of that one because I was over the FDA recommended dose for that, and now I'm at about half of that dose, which is well under that. Effexor, or venlafaxine is the generic. So I used to be on it about 300 milligrams, and now I'm on 150. So my dentist, Dr. Cornish, noticed that I had some issues that he would be able to identify as TMD, and I should come talk to the specialist, which was you. With all of the treatment that I've had with phase 1 and phase 2, being 7 months in, I've improved about 80%. So with brain fog, it used to be pretty bad, something I would experience every day to a certain extent, and some really bad times over a couple month period. But I've noticed probably about an a 90% improvement in that with this treatment. If I have any, it'll be once or twice a month, maybe a 1 or a 2.
And it used to be a lot more.
It used to be way more. So I've probably had a 98% improvement in fatigue. It used to be because I don't sleep very well because I have sleep apnea that I'd wake up in the morning exhausted, and even by 10 o'clock midday I would still be really tired. And now I wake up at probably about an 8 or a 9 out of 10, and I'm rearing to go by 10 o'clock. So anxiety is 100% gone. Since I started getting treatment here, I also worked with a therapist and a psychiatrist, and I'm no longer on any medication. And I'm feeling really good about myself and about the world. So 100% improvement in that. Shoulder pain. So shoulder pain, I've had probably about 85-90% improvement in that because of all my muscles in my face being tight. It caused all and also poor posture, which everybody here in America deals with. It used to be really tight, and it would be really bothersome, almost to the point of debilitating pain with my shoulders. And now I will have very minimal pain every once in a while, and then only some stronger pain whenever I'm doing some physical labor, 85-90%. Lower back, I've had about a 45% improvement on my lower back. I'm still growing. I'm only 17 and got a lot more years to grow. So,
How old are you?
6'3". So, but it has improved a very significant chunk since we started, and I do attribute that to the physical therapy that I got for this, and also just all the other factors that are involved. I guess sleep would be considered one of them. I've just been sleeping so much better. And I think it's probably attributed to having so much more airway for air to get into my system. I have to imagine that I was probably depriving myself of oxygen most times during the day. So I just feel leagues better because of that. So it's working a lot easier, and we're gonna go and get a sleep study done to see where we are progress-wise on that. Yeah, so Dr. Cornish came to me, and he was talking about TMD to me, and how one of his relatives, I think maybe it was his son or daughter, came and got some treatment done, and it was like night and day. And when somebody told me that just moving some teeth around and moving a jaw could fix all of my symptoms, it really did feel like voodoo. You didn't promise, but it's been really beneficial for me.